The Instituto Dr. Scheib specializes in intensive multimodal therapies for mental and psychosomatic disorders. Using the example of a patient with depression and substance abuse, we show our therapeutic approach in a typical case. Our patient agreed to have the course of the treatment documented on video. In the admission interview, the patient reports that he had been on sick leave for 1.5 years due to a severe depression, which he had probably had since childhood. For almost 30 years, with the exception of short abstinent periods, there have hardly been any days without taking drugs or alcohol. In the meantime, they are more a method to somehow continue to function in the system.
So eine Traurigkeit, Lethargie, Melancholie habe ich dann mitbekommen, die habe ich eigentlich seitdem ich denken kann. Okay. Ich dachte allerdings immer, dass es ganz normal ist, dass jeder so denkt und handelt und ja, genau.
Previous inpatient therapies in an addiction clinic and a psychosomatic rehabilitation clinic did not bring lasting success. After a detailed medical history and examination, a psychological test examination, a quantitative EEG, and a measurement of the heart rate variability are carried out. The quantitative EEG shows which areas of the cerebral cortex are active and in what wavelength. This can provide important information for our neurofeedback training program. Our patient shows an increased alpha activity in the frontal area of the brain, which can be found particularly in cases of depression with compulsive brooding and difficulty falling asleep. The heart rate variability shows the influence of the vagus nerve on the control of the heart. It is significantly reduced in depression. Our patient has an increased stress index in HRV. The other parameters are widely within the normal range. We agreed to a therapy plan with the patient consisting of transcranial magnetic stimulation, ketamine infusions in combination with hypnosis, neurofeedback and psychotherapy including EMDR. In repetitive transcranial magnetic stimulation, the activities of certain brain areas is increased or dampened by a pulsating magnetic field. This can be used to treat both depressive symptoms and the tendency towards addictive behavior. We first stimulate the so-called dorsolateral prefrontal cortex on the right side with 1 Hz, then on the left side with 10 Hz.
Wie fühlt sich das an?
Naja, wie ein Ticken.
Wie ein Ticken. Ist aushaltbar.
Ja, klar.
Okay, gut.
The Ketamine-Hypnosis Package combines the strong antidepressants and dissociative effects of ketamine, as well as the improvement of neuroplasticity with hypnotherapeutic interventions, regressions, and the possibility to approach problem solutions more creatively. In this way, our patient remembers important events in his life combined with the associated feelings. Trust in the therapist emerges. Feelings could be more and more noticed and admitted. At the same time, control is handed over. The role of the substances with which he tried to balance his mood became clearer and self-efficacy was increased. The patient found a safe place in himself where he finds strength in crisis situations. Through the treatment, the patient realized that he had never had a relationship with his body, which we worked intensely with. He was able to build a positive relationship with himself, took courage to live independently again, and managed to let go of the old in order to create space for new things. Overall, he discovered a more relaxed self and external assessment, as well as more and more inner balance. At the end of KHP, the patient no longer felt the need to use drugs, with the exception of alcohol and cigarettes. In neurofeedback training, brain activity is linked to an animation. The brain learns to be less active in certain areas through experience of success. This is known as operant conditioning. In our patient, the increased alpha activity in the frontal brain was reduced during training and the beta activity increased. In the second half of the stay, 9 hours of psychotherapy took place, with EMDR being carried out in 5 hours. Eye movement desensitization and reprocessing can be used to deal with the traumatic experiences in particular. There were traumatic experiences in the patient's life that promoted depression and substance abuse. As in hypnosis, this was also about finding a safe place. The results of psychological testing at the start of treatment were compared to those at the end of therapy. The SCL-90 symptom checklist shows the change in physical and psychological symptoms during treatment. Our patient achieved a massive improvement in almost all scales. The patient improved in the Beck Depression Inventory within a few days from severely depressed to not depressed. The patient finally felt that he had now had enough resources to manage his life. In addition, new resources were installed to find new regulatory options.
Wenn ich mir jetzt vorstelle, dass ich 2 Jahre krankgeschrieben war und zwischendrin wirklich ganz üble Phasen mit mir selbst durch hatte, wo ich echt überhaupt keine Lust mehr auf Leben hatte auch. Und jetzt überlege, jetzt bin ich ungefähr diese 10 Tage da und mich beobachte oder in mich reinfühle, wie es mir jetzt gerade geht. Obwohl ich jetzt, wie gesagt, kein Ketamin genommen habe oder sowas, aber was danach halt, dann ist es ein Unterschied, der ist eklatant so. Und das finde ich den Hammer. Das haben wochenlange Psychotherapien und was weiß ich nicht mal ansatzweise hingekriegt. Und wenn das der Schlüssel ist, dann finde ich es abartig, den nicht einer breiteren Gruppe zugänglich zu machen. So.